Good morning, thank you. Good morning and happy Sabbath to everyone. My name is Dr. Dorcas Adepoju. I'm a board certified psychiatrist. I'm here this morning just following up on a presentation that I gave last week, just as an introduction to psychiatry, to introduce people to mental health. And there were a few questions that you guys had. There were about 7. And some of them I'm going to combine because they're just themes behind the answers. So let's get started, and I'll try to keep to time. All right. So one question was, has research suggested a hypothesis as to why there is shrinkage in the brain with depression, and does that vary? So, you know, the brain is an extraordinary organ, and we're just beginning to understand how it works. And so they have to do several different type of studies to try to see what's going on in the brain when someone's depressed. So there's hypotheses, and based on those hypotheses, we direct our treatment. So some of the things that have happened in the brain come from your stress response. So I hope you have heard of cortisol. Cortisol is released when you're under stress, and your brain is supposed to regulate cortisol. But cortisol can get out of control, meaning your brain can stop being able to tell it to stop being produced. Because once your stressor has gone, cortisol is supposed to go down. But when you become depressed, cortisol is just, it just won't stop being produced, and then it's higher, there's high levels in the brain. And then when you have high levels of cortisol, your immune system doesn't work as properly. Your brain cells, your neuronal cells don't work as properly. And so other things that happen when cortisol is released is, there's inflammation that is also released during depression. There are proteins in the body. May have heard of interleukins if some of you are in biology, or TNF alpha, but there's inflammatory proteins that are produced, and that also does not help the nerve cells in the brain grow. And that happens in depression. Another thing that happens is there are certain, so your brain has cells around your actual neurons that help support your neurons so they can grow and mature and develop and make the connections that they need to make so that you can think and process information. So what happens is even those cells start getting destroyed, and they cannot produce the proteins that support the functioning of the cell. So there are just so many things, and that's just a few of the theories of what's going on that causes brain cells to shrink and not develop in certain areas of the brain during depression. Oh, okay, it looks like they only put 1. Maybe I got it wrong. Okay, this one says, how do you choose what type of therapy is right for you? I think that's a good question, and in this congregation there are several therapists, and I wanted to emphasize that psychiatrists mostly, do medicine. We're medical doctors, and we will diagnose mental health illnesses, and then we'll choose a medication or what we call a somatic treatment, like electroconvulsive therapy, transcranial magnetic stimulation, whatever it takes to help to treat the person. We have been trained in therapy, but I would say most of us, our skills are in medicine. But I do work with therapists, and I do incorporate psychotherapy when I do see patients. And so when a therapist is interviewing a patient, they have to first understand what's going on, because the therapies that we do are evidence-based. Research has been done saying that this technique of therapy helps with this disorder, or mental health disorder. let's talk about maybe depression or anxiety or so forth. One of the main ones you may have heard of is cognitive behavioral therapy, and that addresses your thought patterns that cause and perpetuate, your depression, your anxiety, and other illnesses. And when you can identify those thought patterns that are not serving you and then turn them around, you can help improve your mood. And also part of that is changing your behavior. Because when someone is depressed, they tend to want to sit at home and do nothing, lay in bed, and they're tired. But part of that behavioral therapy says get up, plan something, do something. So that's part of cognitive behavioral therapy. That's one therapy. But when I was working with people that were experiencing homelessness at Haven for Hope, one of the theories was when someone is homeless, they're going through a lot of things. They have no home, they don't know where their food is coming from, and a lot of them have no support, and that's why they're homeless. And then sometimes some of them are in a severe level of depression, and because they're in a severe level of depression, their brain has shut down, and they can't problem solve. So part of the therapy that was done there was helping people problem solve. How are we going to get out of this homelessness? How are we going to get you some food? How are we going to get you a job? Those are the practical things that need to be done. You don't want to be emphasizing theoretical type of therapies and psychodynamic therapies, talking about your childhood and all that, when someone just needs to eat, right? So you have to get to the problem. That's one therapy that is done. Another therapy that's done for people that are in severe cases whose brain has shut down is supportive therapy. You don't want to criticize them, you want to listen to them, you want to validate how they're feeling, and so forth. So there's just so many. So you have to look at the patient. What is going on with the patient? What is the problem? What are they capable of handling? So that's how you gear your therapy. And then on top of that, the therapists have to determine whether or not they're even trained to do certain therapies. So if they're not trained to do it, they're likely not going to do it. And they know their craft more than I do. But the therapists that I work with, if they had not gotten supervision in the therapy that they do, then they're not going to do it. So even if it's evidence-based to treat your condition, if they're not trained in it, they're not going to do it. So those are the things that determine. Let's see if I can get to the next. Okay. This is similar to answering that question. Do you notice a decreased need for medication following somatic treatments? And again, I mentioned somatic treatments. That includes electroconvulsive therapy, transcranial magnetic stimulation, pretty much stimulating the brain so it can release the chemicals that you need to feel better. So I would say I know about these therapies in theory. When I was training to be a psychiatrist, I have observed electroconvulsive therapy, and I've had patients in the hospital who were undergoing that type of therapy. So the reason for electroconvulsive therapy is, your medical condition is just so severe that the medicine that we give you is just not enough to take care of the symptoms. And so you're going to need something extra like electroconvulsive therapy. So when that happens, we only discontinue certain medications, and the medications that we discontinue are the medications that won't allow the electroconvulsive therapy to work. Medications that slow down your brain waves, like benzodiazepines or anticonvulsants. So anti-seizure meds, which are sometimes mood stabilizers, and then benzodiazepines, which are those strong meds that help with anxiety. The electroconvulsive therapy cannot work if you're taking those. So prior to getting your electroconvulsive therapy, you might have to stop those meds. But the other meds you continue. Electroconvulsive therapy is powerful. A lot of people don't know that it's very safe. Let's say there's a pregnant woman who has bipolar disorder. She's manic. She's not sleeping. She's up all the time. She's acting erratic. She can't take care of herself or her baby. And it's a very severe case, and we think that she's going to hurt herself. Electroconvulsive therapy is actually a very good therapy for her, and a lot of people wouldn't know that. For severe schizophrenia, severe depression, electroconvulsive therapy. But there's a new therapy called transcranial magnetic stimulation, And it is something that you don't have to be hospitalized for before you get the treatment. You just go into a clinic, you get your brain stimulation. It may take minutes to almost an hour, and then you can actually just drive home. And so what I've seen is, theoretically, once again, these brain stimulation treatments can work, and they have worked, but the treatment doesn't last long. It will fade, and that's why someone needs to continue to be on medicine. Sometimes you'll need less medicine, but I'm not sure if you'll need no medicine at all. So that's my take on it. Let's see. How do you go about treating a child with depression if parents are against the medication? I combined the answer to this question with another question that's here. Yeah, how do you help a child become more resilient to the development of anxiety or depression? So first of all, I have to disclose I am not a child and adolescent psychiatrist. When I was training, I did see all ages. And maybe for about a year, I saw children and adults, but I've been practicing for almost 20 years, and it's pretty much adults. So, but there are some principles that carry over between adults and children, and then some of the things that I have read as well that I'll share with you. So let's see. Let's see if I go back to that one. Okay, so I highly recommend that if a child has depression, that they do get the treatment that they're supposed to get. We do rate depression and depressive symptoms. So if a child has mild depression, they may not need medication. And there's so many therapies out there that can help, including the cognitive behavioral therapy that I talked to you about, supportive therapy, behavioral therapy, focusing on the behaviors that you want and reinforcing them. Those are good therapies. Also, working on the parents, because when children are brought in to see a psychiatrist, it's not always the children that have the problem. Sometimes it's the parents and their parenting. And then there's family therapy as well. Sometimes it's not just the parents. Sometimes it's just the interaction, the communication, the conflicts. So ideally, medication and therapy together will give you the best outcomes, but the least you can do is get the therapy, so you don't want to ignore the symptoms. Let's see, what was that? Oh yeah, and then for resilience, once again, if you're doing that therapy, if you're doing the communication, the behavioral intervention, the child will grow and develop and have resilience. You can build a resilience that way. The last question is there a concern of starting a child on medication if they may not be able to pay for more once they become an adult? And I'm gonna say no, because it's been studied pretty much. Brain development, rapid brain development happens in the first 3 years of a child's life. That's a very important time in a child's life. But children can be exposed to traumatic events. A parent could have died, they could have been abused, or just anything, hunger, homelessness, anything. And that negatively impacts the brain. The sooner that you intervene, the better. Whether it's with therapy or with medication or both, the sooner the better. And because the brain, recommend, just because they're kids and we can get it, because I know children can easily get medical care compared to adults, give them the treatment. Don't be concerned about what happens when they're an adult. When you set them up well, they will do well, and they can inexpensive to maintain that. So thank you for your time.